Welcome to the deep dive. Today, we're getting into a topic that's really um, reshaping how we look at healthcare. I mean, modern medicine, incredible. The things we can do now for infections, for emergencies, it's amazing. But there are gaps. Conventional Western medicine, what we call biomedicine, sometimes struggles with things like chronic stress or those persistent symptoms from long-term diseases, or even just meeting the emotional and, well, spiritual needs of patients.
That's absolutely right. And because of that gap, we're seeing this huge surge, really, in patients looking for other options. They're actively seeking treatments they see as, less invasive, less toxic, more natural. They want more control, more involvement in their own healing. And they often feel that combining different approaches just works better for them. It's a real shift towards a holistic view.
Yeah, and it's not just patients. Even primary care docs are suggesting things like massage or acupuncture now.
Exactly. It's becoming much more mainstream.
So that's our focus for this deep dive: complementary, alternative, and integrative therapies.
Mm.
We're drawing heavily from a key source, the Fundamentals of Nursing, 11th edition Potter, Perry, Stockert, and Hall. And we're not just going to define these terms, we want to explore why this matters so much for you as nursing students, how these therapies actually look in practice, in hospitals, clinics, even homes, and, super importantly, how this all connects to your NCLEX preparation.
hmm Our goal today is pretty straightforward. Give you clear, accurate, practical knowledge. We'll break down some of that tricky terminology, describe procedures so you can picture them, point out those moments where critical thinking is key, and maybe highlight some common pitfalls to avoid. It's all about helping you understand how to weave these therapies into really good patient-centered care.
Okay, perfect. So let's start right there. These terms, complementary, alternative, they sound similar. People use them interchangeably all the time. But the source makes it clear there are some really crucial differences. Let's unpack that.
Absolutely. They might sound alike in everyday chat, but in healthcare, very distinct meanings. And getting this is fundamental for nursing. First, let's just quickly define allopathic or biomedicine. That's our conventional Western medicine. Super effective for acute stuff, bacterial infections, trauma, surgical emergencies, things like that. But as we mentioned, it often hits limitations with stress-related illness, ongoing chronic symptoms, or those deeper emotional, spiritual aspects of health.
Right, which opens the door for these other approaches, like complementary therapies.
Exactly. Complementary therapies are used together with conventional medicine. They complement it. Think of things like therapeutic touch, maybe hypnotherapy, some require extra training, but others, like guided imagery, relaxation techniques, breathing exercises, massage, meditation, even some herbs or supplements. These can often be integrated more easily, sometimes even taught by nurses. They work alongside standard medical care.
Okay, alongside. Got it. So then what makes something an alternative therapy?
This is the key difference. Alternative therapies are used in place of conventional treatment. They become the primary treatment. So the example from the source, a patient managing chronic pain with yoga and lifestyle changes instead of taking their prescribed pain medication. In that case, the yoga isn't complementary anymore, it's alternative. And this is important. Whole medical systems like traditional Chinese medicine, TCM, Ayurveda from India, naturopathy, these are always considered alternative when they're the main approach because their whole philosophy, their understanding of health and disease is fundamentally different from biomedicine.
That makes a huge difference in how you'd approach it as a nurse. Okay, so complementary is with, alternative is instead of. Where does integrative healthcare fit in?
Integrative healthcare is kind of the umbrella term. It's the broader approach that deliberately combines both conventional biomedicine and evidence-based complementary therapies. It's really about a relationship between the patient and practitioner, focusing on the whole person, mind, body, spirit, community, and using all appropriate therapeutic approaches to achieve optimal health and healing. It's evidence-informed, which is key.
And this sounds like it fits perfectly with nursing's core values.
It really does. Which brings us to integrative nursing. This is where you come in. Nursing has always had a holistic foundation, looking at the whole person. Integrative nursing builds right on that legacy. The definition is really insightful. A way of being, knowing, doing that advances the health and well-being of persons, families, and communities through caring, healing relationships. It involves using evidence to guide both traditional and emerging interventions that support whole person, whole systems healing. It's not just tacking on techniques, it's a fundamental perspective.
That really clarifies the landscape. Those distinctions are so important. And You mentioned evidence-informed. It sounds like research in this area is still developing.
It is, definitely. The body of evidence is growing, but we still need more rigorous studies, especially those big randomized controlled trials for many therapies. So for you as a nurse, what does this mean? It means you need to be a critical thinker. Weigh the potential risks and benefits. Look at the therapy's history. I mean, some have been used for literally thousands of years. Consider nursing's experience with it, look at case studies, other forms of evidence, and always, always consider the patient's cultural background and their individual situation.
Okay, let's get practical then. The source mentioned therapies that nurses can actually start learning and using more independently. This is where it gets really hands-on, right?
Yes, these are often called nursing accessible therapies. They tend to use natural processes, breathing, thinking, movement, things nurses can guide patients through. But, and this is crucial, they still demand your clinical judgment. You have to assess if it's appropriate for this patient right now, and then carefully evaluate how they respond. And another key principle, active patient involvement. These techniques work best when the patient is engaged and practices them regularly.
Makes sense. So what's first on the list?
Let's start with relaxation therapy. We all know the stress response, right? Your heart races, breathing gets faster, muscles tighten up, blood pressure goes up.
Fight or flight.
Exactly. It's designed for short bursts. But when stress becomes chronic, it causes wear and tear. Think headaches, digestive issues like ulcers, even atrophy of the immune system over time. It's physically damaging.
So relaxation is the antidote.
Pretty much. The relaxation response is the physiological opposite. It dials down that arousal. When you relax deeply, your muscle fibers lengthen, neural signals to the brain decrease, and you see lower heart rate, lower respiratory rate, lower blood pressure, less oxygen consumption. You even get increased alpha brainwave activity, which is linked to calmness. It's a powerful built-in counterbalance to stress.
How do you actually do it? What are the techniques?
Well, there are a few core cognitive skills relaxation helps develop. Focusing attention, achieving passivity, sort of letting go of goal-oriented thinking, and receptivity, being okay with uncertainty. Two common techniques nurses can teach are progressive relaxation.
Where you tense and release muscles.
Right. You guide the patient to systematically tense, say, their facial muscles, hold it, then release completely, noticing the difference. Then move to the arms, hands, abdomen, legs, feet, all while breathing slowly and deeply from the abdomen. The other main one is passive relaxation. This one achieves relaxation without the act of tensing. It involves just quieting the mind, focusing on slow breathing, maybe imagining warmth or heaviness flowing through different body parts. This is often better for patients who are very fatigued, maybe with advanced cancer or AIDS, where the tensing part might be too tiring.
And the clinical payoff. Where do you see this used effectively?
Oh, the applications are broad. Lowering blood pressure, heart rate, easing muscle tension, just improving overall well-being. It's really good for reducing symptom distress, think pain, side effects from cancer treatment, complications of chronic illness, even grief. Studies show it can reduce the need for opioids, lower anxiety, even in really stressful settings like the ICU. It helps with depression, shortness of breath, and hey, it even helps us nurses using relaxation report less workplace stress, better job satisfaction.
That's huge. Any downsides or things to watch out for?
Initially, some people become more aware of muscle tension, which can feel a bit strange. The main thing to watch for, though it's rare, is that sometimes relaxation can actually intensify symptoms or even bring up new ones. If that happens, stop the technique, assess the patient thoroughly, and definitely let the healthcare provider know right away.
Good to know. Okay, moving on to meditation and breathing. How is this defined?
Meditation, fundamentally, is any activity that limits distracting stimuli by focusing attention on just one thing. Could be your breath, a sound, an object, a word. It's about increasing self-awareness by relaxing the body and quieting the mind. It often has roots in religious traditions, but its health benefits are well recognized now. There are usually 4 key elements: a quiet place, a comfortable position, doesn't have to be cross-legged, a receptive or passive attitude, and that focus of attention.
And the research backs this up.
Strongly. Research shows meditation can lower both systolic and diastolic blood pressure, cutting the risk for hypertension. It helps reduce relapse rates in alcohol treatment. For cancer patients, mindfulness-based approaches decrease depression, anxiety, distress, and improve quality of life. It's also shown benefits for PTSD and chronic pain. Beyond illness, it can improve productivity, mood, sense of self, and make people less irritable.
Sounds great. Limitations.
The main one is it takes self-discipline. You have to practice it regularly. But here's a really critical point for nurses. Meditation might increase the effects of certain medications. Be especially vigilant with patients on antihypertensives, thyroid meds, or psychotropic drugs. You absolutely need to monitor their vital signs, watch for changes, and anticipate that their doctor might need to adjust dosages.
That's a crucial safety point. Okay, next up, imagery or visualization. This feels a bit more intuitive, maybe.
It can be, yeah. Imagery is a mind-body therapy. You use your conscious mind to create mental images, and the idea is that these images can stimulate physical changes in the body, improve well-being, or just enhance self-awareness. It often goes hand in hand with relaxation.
Can you walk us through how guided imagery works?
Sure. Typically, you'd start with some slow, deep abdominal breathing to help the person relax. Then you guide them to visualize a specific peaceful image, maybe waves on a beach, quiet garden, whatever feels good to them. You encourage them to engage all senses. What do they smell, hear, feel? Is it warm, cool? Then you might progress to visualizing, say, warmth entering the body with each breath and tension flowing out. The absolute key is tailoring the image to the individual. You want positive associations, not something that might trigger negative memories.
And this actually causes physical changes.
The research suggests yes. Imagery can affect things like gastric secretions, body chemistry, blood flow, even wound healing and heart rate. It's tapping into that mind-body connection. There's also creative visualization, which is more self-directed. You teach patients to create a clear, pleasing image related to their goal, visualize it often, especially before sleep or upon waking, and maybe pair it with positive affirmations.
What conditions does it help with most?
It's widely used for pain control, relieving stress symptoms, improving sleep. It also helps manage symptoms in chronic conditions like asthma, cancer, sickle cell anemia, migraines, IBS, rheumatoid arthritis. Quite a range.
Any significant limitations or risks with imagery?
Generally, side effects are few. But one important caution. For patients with COPD or asthma, you need to monitor them closely. Occasionally, guided imagery can actually increase airway constriction in susceptible individuals.
Okay, that covers the therapies nurses can often learn and apply more readily. Now let's shift gears to therapies that definitely require specialized training and often certification. Nurses won't be doing these themselves without extra education, but knowing about them is vital for patient discussions and referrals, right?
Exactly. You need enough knowledge to talk intelligently with patients about these options, answer their basic questions, understand potential interactions with their conventional care, and know when and how to refer them appropriately. Ensuring safety is paramount when these are combined with medical treatments.
So first in this category, biofeedback. What's the principle here?
Biofeedback is a fascinating mind-body technique. It uses electronic instruments to give patients real-time, direct feedback, visual or auditory, about their own physiological processes. Things like muscle tension, skin temperature, heart rate, even brain waves. By getting this immediate feedback, the patient learns, often with coaching in relaxation and breathing, to gain voluntary control over bodily functions that are normally involuntary.
Interesting. So what's it used for, and are there any catches?
It's shown good results for reducing headache pain, particularly migraines, and tension headaches. It's also beneficial for urinary incontinence, especially after prostate surgery, and potentially for fecal incontinence and stroke recovery. A key factor for success is patient adherence. They really have to practice the techniques. As for limitations, sometimes during sessions, repressed emotions or anxieties can surface. So practitioners really need to be trained to handle that or have mental health professionals they can refer to. Also, long-term practice can lower blood pressure and heart rates, so again, nurses need to monitor for this, especially if the patient is on related medications.
Okay. Next, let's tackle a big one. Traditional Chinese medicine, or TCM. You mentioned this is a whole system.
Yes, it's ancient, thousands of years old. TCM views health fundamentally as life in balance. It's not just the absence of disease, but a state of harmony, physical, emotional, spiritual well-being. Two core concepts you often hear about are yin and yang. These represent opposing forces like night-day, hot-cold, passive-active, that are interconnected and need to be in dynamic balance. Imbalance leads to illness. The other huge concept is qi, pronounced qi. This is understood as the vital life energy or life force that flows throughout the body.
And it flows through specific pathways.
Exactly.
Yep.
These pathways are called meridians. TCM believes that disruptions or blockages in the flow of qi through these meridians are the root cause of disease. TCM practitioners have their own diagnostic methods, observing, listening, smelling, asking detailed questions, touching, especially palpating the pulse at the wrist and examining the tongue.
And the treatments are diverse.
Very. Modalities include acupuncture, specific Chinese herbal formulas, Tuyin massage, moxibustion, which is burning mugwort herb near the skin for warmth cupping, tai chi and qigong, which involve specific body movements and breathing to regulate qi, plus dietary and lifestyle recommendations. Tai chi, by the way, has good evidence for improving balance and reducing falls in older adults. Some evidence suggests TCM might help with fibromyalgia symptoms too.
Now, you mentioned safety concerns earlier, especially with herbs. Can you elaborate?
Yes, this is critical for nurses to understand. In most parts of the US, TCM as a whole system isn't tightly regulated, though acupuncturists usually are licensed. The biggest safety concern revolves around Chinese herbal medicine. The FDA does not regulate these herbs as drugs. They're considered dietary supplements. This means there's no guarantee of safety, purity, potency, or correct dosage. Contamination with heavy metals, pesticides, or even unlabeled pharmaceuticals is a documented problem. And perhaps most importantly, these herbs contain powerful bioactive compounds that can have serious interactions with conventional drugs. Think blood thinners like warfarin or aspirin, cardiovascular medications, and many others. So the take-home message for nurses is always, always ask patients specifically if they are using any herbal remedies or supplements, because they often don't think to mention them.
That's a really crucial point. Okay, let's focus specifically on acupuncture, since it's a well-known part of TCM, but also used independently.
Right. Acupuncture aims to regulate that flow of qi we talked about. It involves inserting very fine, sterile needles into specific points, called acupoints, located along those meridians. The idea is to influence the energy flow, unblock stagnation, and restore balance. Sometimes the needles are stimulated with gentle heat, moxibustion, or a mild electrical current, that's electroacupuncture.
And what does the evidence say acupuncture is good for?
There's good evidence that it modifies the body's perception of pain. It's considered effective for low back pain, certain types of myofascial pain, and for nausea and vomiting caused by chemotherapy, usually used alongside standard anti-nausea meds. It's also frequently used for tension headaches and preventing migraines. Other uses include GI disorders, hot flashes, potentially depression as an adjunct, and PTSD.
What about risks? Is it safe?
When performed by a well-trained licensed practitioner using sterile, single-use needles, it's generally very safe. However, complications can happen, though they're rare. Things like infection if sterile technique isn't perfect, needles breaking, nerve injury, or very rarely, puncture of an organ. Some people might feel faint, dizzy, or experience minor bleeding or bruising at the site. There are definite contraindications or cautions. Pregnancy, certain points are avoided. Seizure disorders, bleeding disorders, or being on anticoagulants, having skin infections near the points. Patients with hepatitis or HIV need careful consideration regarding infection control. And electroacupuncture is a no-go for anyone with a pacemaker, certain heart rhythm problems, epilepsy, or during pregnancy.
Okay, let's move to another category, touch therapies, specifically therapeutic touch, TT.
Yes, therapeutic touch is one of the energy therapies. The core idea is that it influences the energy fields believed to surround and permeate the body. The practitioner uses their hands, often without direct skin contact, with the conscious intention to help or heal. It actually blends some Eastern concepts of energy with modern nursing theory developed by Dolores Krieger.
How is it actually performed? Can you describe the steps?
There are generally 5 phases. First is centering. The practitioner takes a moment to become calm, present, and focused. Second, assessing. They use their palms, usually held 2 to 6 inches away from the patient's body, to scan the energy field, looking for sensations like warmth, coolness, pressure, tingling, or static-free. These are thought to indicate imbalances or blockages. Third, unruffling. The practitioner uses long downward strokes over the energy field, either lightly touching or staying slightly off the body to sort of smooth out or clear congested energy. Fourth is treating or modulating. This involves directing energy to areas that feel depleted or helping to rebalance areas that feel excessive. And finally, evaluating. They reassess the energy field to see if it feels more balanced and flowing and check in with the patient about their experience.
Interesting. What's the evidence say about TT? And any precautions?
Well, the research evidence for TT is actually premixed and often criticized for methodological flaws. It's considered inconclusive by many scientific reviews. However, some studies suggest it might be helpful for reducing pain in both adults and kids, anxiety, and possibly improving function in people with dementia or easing trauma symptoms. It's often highlighted as potentially beneficial for older adults who might be experiencing skin hunger, a lack of touch providing comfort, connection, and boosting self-esteem. Limitations. Few direct physical complications, but it's really important to be sensitive. For patients with a history of physical or sexual abuse or certain psychiatric conditions, Any form of touch, even non-contact, can be misinterpreted or feel threatening. You must assess for trauma history. Also, use caution with pregnant women, newborns, and anyone with significant cardiovascular or neurological instability. Sessions should be shorter and very gentle.
Okay. What about Pilates? How does that fit in as a therapy?
Pilates isn't just general exercise. It's a specific mind-body system developed by Joseph Pilates. It focuses on core strength, posture, and controlled movements. It's based on 6 key principles: centering, focusing on the core; concentration, control, precision; flow of movement, and breathing. It's really adaptable. You see it used for kids, teens, adults, older adults. It's great for improving muscle strength, flexibility, coordination, balance, and overall functional status. It has shown benefits for chronic back and neck pain and in fall prevention programs. It can also be a good way to get people moving who might be hesitant about other forms of exercise.
Makes sense. Let's
Yeah.
talk about chiropractic therapy. What's the core idea there?
The central belief in chiropractic is that the body's structure, mainly the spine, and its ability to function are intimately related. They believe misalignments in the spine, called subluxations, can interfere with nerve function and the body's innate ability to heal itself. The primary treatment method involves spinal manipulation or adjustments. These are controlled, sudden, forceful movements applied to specific joints, often moving them just beyond their usual passive range of motion. Chiropractors often combine adjustments with other things like ice, heat, electrical stimulation, massage, exercise recommendations, or lifestyle counseling.
What conditions is it typically used for, and what are the safety flags nurses should know?
It's commonly sought out for low back pain, neck pain, and headaches. Research supports its effectiveness for acute and subacute low back pain, and possibly for joint pain related to osteoarthritis. Some studies suggest it might help reduce the need for pain medication for back pain. It's also used sometimes for musculoskeletal pain in cancer patients, and some limited research suggests potential benefits for asthma in kids, though that's more controversial. But it's definitely not for everyone. Contraindications include bone or joint infections, certain spinal cord conditions, acute myelopathy, fractures, dislocations, inflammatory arthritis like rheumatoid arthritis, and severe osteoporosis. Risks can range from mild, temporary side effects like headache or increased soreness to rare but serious complications like vertebral artery dissection leading to stroke or herniated discs. So as a nurse, if a patient is considering chiropractic care, you absolutely should advise them to verify the chiropractor's education and state licensure and discuss the potential risks and benefits thoroughly.
Okay, one more major category, natural products and herbal therapies. We touched on herbs with TCM, but this is broader. These are everywhere.
They really are, and herbal medicine is arguably the oldest form of medicine we know, used for tens of thousands of years. And we can't stress this enough in the US, most herbal products and other natural supplements are sold as dietary supplements, not as drugs. This means they are not regulated by the FDA for safety, effectiveness, or purity in the same way prescription or over-the-counter drugs are.
So natural doesn't mean safe.
Not at all. That's probably the single most important takeaway. Concentrations of the active ingredients can vary wildly from batch to batch, even within the same brand. Contamination with pesticides, heavy metals, or even undeclared pharmaceutical drugs is a real and documented concern due to lack of rigorous quality control mandated by the FDA for drugs.
What are some common ones people use?
Oh, things like fish oil omega-3s, glucosamine, often with chondroitin for joint health, probiotics for gut health, melatonin for sleep, echinacea for colds, cranberry for UTIs, garlic for cholesterol, blood pressure, ginseng for energy, ginkgo biloba for memory. The list is long.
The source has tables outlining potential uses and risks. Can you give a couple of examples?
Sure. Let's look at Table 32.2, which lists some herbs considered relatively safe or possibly effective. Aloe vera, used topically for burns, skin inflammation. Taken orally, it can be a strong laxative and might interact with other laxatives. Garlic, often used for high cholesterol or blood pressure. But, importantly, it can inhibit platelets, meaning it thins the blood so it can interact dangerously with warfarin, aspirin, clopidogrel, other blood thinners. Valerian, common for sleep problems or mild anxiety. But it can cause central nervous system depression and shouldn't be mixed with barbiturates, other sleep meds, alcohol, or even some antihistamines.
And the flip side, Table 32.3 lists unsafe herbs.
Right, this highlights the dangers. Natural can be toxic. Calamus contains carcinogenic compounds, can cause kidney damage and seizures. Banned in the U.S. Comfrey. Also contains carcinogens and can cause serious liver damage, veno-occlusive disease. Restricted for internal use. Ephedra, mahuang. This was widely used in weight loss products. It's a powerful CNS stimulant, bronchodilator, cardiac stimulant. Very unsafe for people with hypertension, heart disease, diabetes, thyroid issues. Interacts dangerously with caffeine and many meds. Banned by the FDA in supplements. This just underscores that these are potent substances.
So what's the crucial advice for patients using these?
Teach them to be savvy consumers. Buy only from reputable manufacturers that clearly list the scientific name of the plant, the manufacturer's name and address, a batch or lot number, and an expiration date. Encourage them to look for third-party verification seals, like the USP Verified Dietary Supplement Mark. That offers some assurance about quality, purity, and potency. And hammer home the point about interactions. Reiterate that these are chemicals, they can interact significantly with their prescription meds, and they must tell their doctor and pharmacist about everything they're taking, including herbs and supplements. Don't assume they'll volunteer it, ask directly.
Wow. Okay, that's a lot of ground covered on specific therapies. This whole discussion really brings it back to the nurse's role, doesn't it? We're kind of the hub here.
Absolutely. The nurse's role is pivotal in integrative care. The whole healthcare landscape is shifting. You see major professional groups like the American College of Physicians recommending things like Tai Chi or yoga for low back pain now. The Joint Commission requires hospitals to provide non-drug options for pain management. This is becoming standard practice. Nurses are perfectly positioned. You have the most patient contact. You build trust to facilitate open, honest conversations about all the approaches patients are using or considering. You're central to helping them make informed decisions.
So, boiling it down, what are the absolute must-have competencies for nurses navigating this area?
Okay, key things. You need enough baseline knowledge to discuss the spectrum, both biomedical and complementary options. You must make it routine practice to directly ask patients about their use of any complementary therapies. Don't just ask about medications, ask about herbs, supplements, yoga, meditation, chiropractor visits, everything. Know where to find reliable information about the evidence, what works, for whom, when, and what are the risks or precautions. Understand basic credentialing for different practitioners and how to make appropriate referrals. Be able to clearly explain potential benefits and risks in plain language. Critically, help patients understand when they absolutely need conventional medical care, like acute chest pain or a suspicious lump, versus when complementary therapies might be a safe adjunct for symptom management, like chronic back pain or IBS. And always know your state's Nurse Practice Act regarding complementary therapies. Practice within your legal scope.
Let's tie this together with that case scenario from the source. Carmen, 48, stage 3 breast cancer, back in the hospital with a suture infection. She's withdrawn, scared about being hospitalized again, worried about drowsiness from pain meds. How could a nurse use integrative approaches here?
This is a perfect illustration. First, you assess Carmen fully, physically, emotionally, mentally. She's fatigued, she's fearful. So active progressive muscle relaxation might actually be too much for her right now, too draining. But passive relaxation, or maybe guided imagery focusing on comfort, healing, or a safe space. Those could be fantastic for managing her pain and anxiety, potentially reducing her need for opioids and thus easing her worry about drowsiness. Simple breathing exercises could give her a tool to manage moments of panic or fear. Meditation, even just brief mindfulness moments, could help her cope with the feeling of being overwhelmed. You see how the nurse uses clinical judgment, matching the therapy to Carmen's specific state and needs, involving her, empowering her to participate in her own comfort and healing. That's integrative nursing right there.
What a comprehensive journey through these diverse approaches to healing.
Yeah.
It's so clear that understanding complementary, alternative, and integrative therapies isn't just some, optional extra. It's truly becoming an essential part of providing that holistic, patient-centered care we strive for.
Exactly. Healthcare is changing, and your ability to thoughtfully integrate evidence-based complementary approaches, always prioritizing safety and advocating effectively for your patients, is going to make you an incredibly valuable member of any healthcare team.
So here's something to think about as you move forward in your nursing journey. How will you use this knowledge? How will you leverage these diverse strategies to empower your patients and really care for the whole person, their mind, their body, and their spirit in whatever clinical setting you find yourself in?
We really hope this deep dive has clarified things, maybe sparked some new ideas about how you can approach patient care. Thank you so much for joining us and being part of the Deep Dive Learning community.
We'll be here for your next deep dive.